I'm Dr. Andy Pawlovich, and I'm a chiropractor here in Saskatoon, and I own and operate Pawlovich Chiropractic. What we're primarily known for when we do treat patients, typically we work on the spine of each patient, and it's targeted to making sure that the brain and the body are communicating better. Many people identify us with people with back pain. If someone has lower back pain, mid back pain, neck pain, and headaches. If someone was to ask the public what a chiropractor does, often those conditions seem to creep in. But then there's other issues that people might not be aware of. Typically, your headaches, neck pain, low back pain, those kinds of challenges where it's restricting people in what they want to be able to do, the quality of life issues that they're having, and we want to help address those. So I was in the 7th grade. I still play a lot of sports, so very active in sports, and I injured my arm pitching in baseball. And my dad took me to his chiropractor, and I had no idea what one was. And it quickly resonated with me. Reason being is they were helping athletes. I figured if I couldn't play professional sports, I wanted to help people, athletes as best as I could. And I quickly found out it wasn't just, I was going for athletic injuries, but they were helping anybody and everybody. They were doctors. They seemed to be really happy. And it wasn't your traditional type of healthcare model, no drugs and surgery, and that really appealed to me even at that age. So I went to Walter Murray and then went to the University of Saskatchewan. In Canada, there's one school, there's actually 2 schools, but one is situated in Quebec and is purely for Francophone speaking students. I chose to go to Minneapolis, Bloomington, Minnesota, to Northwestern Health Sciences University is what it's called now. It was closer and it had a few different options that appealed to me. So I was 24 years old when I graduated, and it took me about 6.5 years to get that done. But typically it's, that's 8 years worth of education or more, and it usually takes about that amount of time before you're graduated and you're licensed and ready to practice. There was one particular female patient, she could barely walk. She was in tears. Her back pain was so severe that she would probably need an ambulance for her to leave the office. That's how much pain she was in. And I told her that. I said, we'll see how this goes, and I'm going to do the best to help you very gently and carefully. And did what I did and asked her to get up off the table. She couldn't believe the fact that she went from being completely bent over and bent out of shape to being able to walk around, and the look on her face of amazement and comfort and relief was unbelievable. So that's just a recent one, and even when she comes in, she's still very grateful for that result. And it was neat for all of us to see, including me, how dramatic of a change occurred in almost an instant. It's a growing industry because the public is becoming more accepted of it, as well as its other healthcare professionals are starting to recognize its efficacy and its effectiveness and starting to work with us as well. So it's definitely becoming more widely used within the population. There's a lot of very smart people, obviously you need to have good grades and need to use your head quite a bit, and we need people like that in our profession. But you also have to be a people person, and if being with people doesn't energize you, then it might not be the best fit for you. But not to say you shouldn't be in healthcare or anything like that. You have to be able to communicate with people and deal with a lot of their different issues in a certain amount of time. There's a lot of different techniques in terms of if you're a small person or a big person, that kind of thing. Like You know, a small individual can still be a chiropractor who doesn't have a lot of strength. There's lots of different techniques, and you can have a different type of focus in your practice. There's lots of room for males and female chiropractors of every different shape, size, you name it. I just think you better like people.